If you're still struggling with chronic low back pain or leg pain from an L4, L5 disc herniation or L5-S1 disc herniation, it's probably because you're not addressing the underlying cause. Now, first and foremost, I want to assure you that it is not your fault. In our office, we see patients that have literally been to countless other clinics. They have tried all sorts of therapies, from physical therapy to pain management, injections, pain pills, even other forms of chiropractic, and these treatments have all failed them. Why? Because they did not receive the non-surgical E.A.T or E.A.T protocol of correcting the underlying cause of most L4, L5, and L5-S1 disc herniations. Now, the consequences of not correcting the root cause of the disc herniation, you will continue to have pain and suffer with leg pain, back pain, and disability, and have a poor quality of life. Even worse, the spine and the herniated discs can continue to degenerate, eventually landing you with a back surgery. And 50% of spinal surgeries do fail. So that's something that we want to avoid if at all possible. Now, what is the E.A.T or E.A.T protocol and where did it originate from? Well, that is exactly what I'm going to cover in this video. The E.A.T protocol is backed by over 340 peer-reviewed research studies. It is a safe, effective, and not only can help with achieving permanent relief of pain, but it specifically works on correcting the hidden underlying cause of almost all disc herniations without risky back surgery. The E.A.T protocol is not functional exercise. It's not a modality like laser, electric stimulation, or shockwave. It's not acupuncture, and it's not spinal decompression. Keep watching to the end of this video because missing any part could be the very reason why you continue to suffer with back pain and leg pain and possibly never discover or correct the underlying root cause of your disc injury. Hi, I'm Dr. Marc Dupuis, a corrective care chiropractor in Sanford, Maine. This channel is dedicated to providing you information so that you can move better, perform better, feel better, and have overall better health. Before I dive in, take a moment to subscribe to this channel now if you want to enhance your posture and spinal health to feel better, move better, perform better, and have better overall health. So what is the E.A.T or E.A.T protocol? Let's dive in. The first part, the E, what does that stand for? It stands for exercise, but not just any kind of exercise. It stands for mirror image exercise. The A stands for adjustment, but it's not your conventional chiropractic adjustment. These are specific mirror image adjustments. And then the T, what does that stand for? Well, that is traction. And once again, you should be picking up there's a theme here, not just any standard traction like lengthwise axial traction. This is specific mirror image traction. Now, the E.A.T protocol was developed by the founders of chiropractic biophysics, otherwise known as CBP. CBP is literally the world's most research-supported corrective care chiropractic technique in the world. Chiropractic biophysics has over 340 peer-reviewed research studies, and many of these studies are published in the highest level Q1 medical rehabilitation journals. So now you know what the E or E.A.T protocol stands for. Well, how does the application help correct the underlying cause of many disc herniations? Well, it's really pretty simple. It goes back to basic physics 101. Structure determines function. The true root cause of the majority of disc herniations is the spine over time shifting, bending, twisting, becoming crooked compared to where your spine should be. Over here you can see what a perfect spine should look like from the frontal plane and from the side plane. If over time your spine shifts like many of ours do, that often happens due to accumulated physical stress, accidents, work, postures on the phone, etc. Chemical stress, air we breathe, water we drink. When we're eating things and you look at the label and you can't pronounce the ingredient, That can drive inflammation, which can cause dysfunction and over time, a collapsing of the spine. And of course, emotional stress, that tends to pull us right out of those good, healthy postures into a more fetal protective fight or flight posture. Over time, many of us lose the ideal position of our spine, and this puts much force into regions of the spine that aren't designed to handle additional force. Such tissues like discs can break down when we have spines that deviate from where they're supposed to be. So conventional therapies can be very helpful in relieving pain on a short-term basis, but to get to the root cause, if your spine has lost its normal position, its normal alignment, if your posture has failed, you have to restore posture. You have to move your spine to a more ideal position so it then functions better and distributes weight more evenly. So that's why the E.A.T or E.A.T protocol is so effective, because yes, it allows the common therapies that we use to provide short-term temporary relief, adjustments, physical therapy, exercise, but the E.A.T protocol is the rehabilitation that gets added to the traditional care that can help restore normal spinal alignment and improve posture to better distribute loads and weights, so that way the spine can actually perform like it's supposed to. When you do that, now you're directly addressing the root cause of a majority of L4, L5, and L5-S1 disc herniations. So how do you know if you need the E.A.T or E.A.T protocol? Well, it's pretty simple. Number one, you need to see a corrective care chiropractor. Number two, you have to have the appropriate examination process. So our exam starts with the weight-bearing posture screen. We need to look for signs that that spine has shifted from normal position. And then that is followed by neurologic and orthopedic examinations to make sure we look for certain tissues that may be involved, like discs that are herniated or nerve roots that are compromised. And then very, very important, we have to have weight-bearing x-rays done in a repeatable, reliable manner so that we can capture the patient's actual spinal alignment. Once we have the postural examination, the orthopedic neurologic examination completed, and the weight-bearing x-rays, we do a detailed analysis and we can show exactly if you have deviated from normal. And then really it's just reverse engineering from there. If the spine has shifted from where it's supposed to be, what do we need to do to move that spine back where it should be? It's pretty simple, but not necessarily easy. That's why so few of us have the training and have the equipment. Behind me, you'll see some Denny roll traction table systems. These are tables that allow us to do three-dimensional tractions on the spine in a variety of ways to help restore abnormal postures. This is one of the most advanced corrective spinal rehabilitation centers in New England. Now that you know what the E.A.T or E.A.T protocol is, how to determine if that is something that you need, I want to share a recent story with you so you can see how effective this protocol is. The pictures you're about to see are from a 68-year-old male who had been suffering with debilitating back pain for decades. As you can see, the spinal alignment is far from normal. In fact, whenever we shift more than just 50 millimeters forward, that is now considered adult spinal deformity. This fellow was about 125 millimeters forward. That's almost 5 inches of forward translation. That has a high risk of increased pain, disability, and even mortality. So now what you're going to see is after 10 weeks of doing a specific E.A.T protocol, this is what we now see. That spine has shifted dramatically back towards normal, and about halfway through, at about the 5th week of work, for the first time ever, he became pain-free in his low back while working. So that's just one example of how what a significant change you can make with the E.A.T protocol regardless of age. So now that you have a thorough understanding of the E.A.T or E.A.T protocol and chiropractic biophysics and how the E.A.T protocol aims to correct the underlying cause of majority of L4, L5, and L5-S1 disc bulges and herniations. Hopefully you can take this information and apply it to your life or lives of friends or loved ones that may need this care. Now, I want to hear from you. What has been your experience with getting treatment for L4, L5 disc herniations? What has worked for you? What has not worked? Let me know in the comments below. If you want help looking for a corrective care chiropractor in your city, reach out, leave comments below, and I can send you links to our doctor locator directory to find such a provider in your region. If you have found value in this video, please like it and share it because it helps with the YouTube algorithm. We want to reach as many people as possible to spread the word on a very safe, effective, science-backed method for improving the underlying cause of a majority of L4, L5, and L5-S1 disc herniations without having to resort to surgery. Thank you very much for your time and attention. Have a great day.